Hey everyone, welcome to another deep dive. We're targeting this one to our first year ophthalmology residents out there.
Absolutely. That first year is tough. So much to learn.
Right, so much new information coming at you from all directions.
So we thought we'd go back to basics with you.
Yeah, little refresher never hurts. We're taking a look at this Squint textbook.
A classic.
It is. And we thought we'd revisit some of those core concepts.
The foundations of eye movements and coordination. We're talking definitions, anatomy, and even the sensory side of things.
The stuff every budding ophthalmologist needs to have down pat. Okay, let's start with some of those fundamental terms that get thrown around all the time. I'm talking about the visual axis, orthophoria, heterophoria, and heterotropia.
I still remember how important it was to really understand those distinctions.
Oh, absolutely. So let's break those down. What exactly are we talking about when we say visual axis?
Well, the visual axis is like the ideal scenario. Each eye's fovea is locked onto the target, giving you that perfect, crisp image.
Got it. So then what about orthophoria? How does that fit in?
Orthophoria is when your eyes just naturally stay in that aligned position. Even when you're not specifically focusing on anything, they're perfectly balanced.
But let's be real. Most people don't have perfectly aligned eyes all the time.
Right. Yeah, that's where heterophoria comes in.
Heterophoria. So that's when...
It's like a subtle tendency for the eyes to drift apart.
Okay.
When you're not actively using your fusion reflex to hold them together.
So it's like those eye muscles are taking a little break, knowing they can snap back into alignment when they need to?
Exactly. Like a car with a slight alignment issue. It might drift a bit, but the driver can correct it.
I get it. But then we have heterotropia, which is a whole other story.
Right. Heterotropia, or strabismus, as it's often called. That's when the eyes just can't align.
Even when you're trying to focus.
Exactly. A constant misalignment. And it can be caused by so many things. Muscle problems, differences in the eye's focusing power.
Fascinating. Okay, so let's shift gears a bit and talk about the muscles that make all these intricate eye movements possible. 6 extraocular muscles. I was always amazed by how they work together.
It's a beautifully orchestrated system.
Oh, yeah. So let's start with the basics. Which muscles are we talking about here?
Well, we've got the horizontal movers, the medial and lateral rectus muscles.
Okay, so the medial rectus pulls the eye inwards adduction.
That's right.
And the lateral rectus pulls it outwards abduction.
Exactly.
Then we have the vertical recti, the superior and inferior rectus muscles. But it's not as straightforward as just up and down, is it?
Nope. They have these secondary actions depending on the eye's position. The superior rectus mainly elevates the eye, but it also contributes to inward rotation. We call that intorsion. And the inferior rectus does the opposite. It mainly depresses the eye and helps with outward rotation or extorsion.
And this is where that handy mnemonic, the spiral of Tolowo, comes in to help remember the insertion points of these muscles.
Absolutely. It's like a spiral staircase starting at the medial rectus, going to the inferior, then the lateral, and finally the superior rectus, the furthest from the cornea.
And that's important for more than just anatomy quizzes, right?
Oh, yeah. Surgeons use this knowledge all the time during procedures. It helps them target the correct muscle.
Avoid any damage.
Precisely. It's like a roadmap of the eye muscles.
And speaking of precision, let's talk about the obliques. The superior and inferior oblique muscles. Those are always a bit trickier for me to picture.
The superior oblique definitely wins the prize for complexity with its tendon looping through that trochlea. Its main job is intorsion, but it also helps with depression and abduction.
Okay, and the inferior oblique?
Thankfully, a bit more straightforward. It mostly extorts the eye and assists with elevation and abduction.
And of course, we can't forget about those muscle pulleys. They play a crucial role too, right?
Absolutely. It's like they're the stagehands behind the scenes.
Making sure everything runs smoothly.
It's amazing. Those pulleys act as the functional origin of the rectus muscles, fine-tuning their actions.
And preventing interference between those vertical and horizontal movements.
You got it. Precision and coordination at its finest.
It's like a puppeteer expertly manipulating the strings to create this seamless dance.
That's a great analogy. That's exactly what's happening every time we move our eyes. All those muscles working in perfect harmony.
Amazing. But we've only scratched the surface. There's so much more to explore with eye movements.
Yeah.
Different types, and the laws that govern their coordination.
Oh, and don't forget about the sensory magic that lets us perceive the world around us.
We'll get to all of that in the next part of our deep dive.
Stay tuned. It's going to be a fascinating ride.
Welcome back, everyone. It's time to dive deeper into those eye movements. We touched on the muscles and their actions, but now let's talk about the different types of eye movements. Ductions, versions, and vergences.
Oh, yeah, those terms. They always kind of tripped me up as a resident.
Me too. So let's break them down and make it crystal clear. What exactly are ductions?
Ductions are the simplest type. They describe the movement of just one eye at a time.
Okay, so just one eye, up, down, left, right.
You got it. And even those rotations we discussed, intorsion and extorsion.
Right, so it's like we're isolating each eye and looking at its full range of motion.
Exactly. And that's super important clinically when you're testing a patient's ductions.
Because you're assessing the individual muscles, looking for any weakness or limitations.
Exactly, like giving each muscle a solo performance.
Love that analogy.
Yeah.
Okay, so that's ductions. What about versions?
Versions involve both eyes moving together in the same direction.
Ah, okay, so like when we look left or right together.
Precisely. That's called dextroversion for looking right and lavoversion for looking left.
Dextroversion and lavoversion. Gotta love those fancy terms.
And don't forget elevation when both eyes look up and depression when they look down.
Right. All essential for coordinating our gaze, making sure those eyes are working in sync. But then we have vergences. And those are where things get a little bit, counterintuitive.
Yeah, the eyes move in opposite directions.
Right. It's all about adjusting our focus for different distances.
Exactly. The classic example is convergence. The eyes turn inwards, usually when we're focusing on something up close, like reading a book.
Oh, yeah. I feel that convergence happening right now. And my eyes are starting to feel a little strained.
Happens to the best of us. And then you have divergence, the opposite of convergence.
So that's when we shift our focus to something farther away. The eyes move apart.
Exactly. Relaxing those muscles. And here's a fun fact. Convergence isn't just a voluntary movement. It also has a reflex component tied into accommodation.
Oh, that's right. Accommodation. When the lens changes shape to focus on objects at different distances. So as we accommodate for near vision, our eyes automatically converge as well.
That's the ticket. It's all beautifully interconnected, and that relationship is measured by the ACA ratio.
Right? The ACA ratio.
Yeah.
Which tells us how much convergence happens for each unit of accommodation.
Important stuff to know for understanding and managing strabismus.
Absolutely. So much complexity in these seemingly simple eye movements.
It really is mind-blowing. But the fun doesn't stop there. The textbook also delves into the laws that govern all this intricate coordination. You know how our eye muscles work in perfect harmony?
Yeah, those laws were always fascinating to me.
Let's start with Sherrington's law of reciprocal innervation, all about balance,
Okay.
When a muscle contracts its antagonist, the muscle that opposes its action relaxes.
So, for example, if the medial rectus contracts to pull the eye inwards, the lateral rectus automatically relaxes.
Exactly. It's a beautiful system of checks and balances.
Keeps everything running smoothly.
And then you have Herring's law of equal innervation. Takes that coordination to a whole new level.
Okay, how so?
It states that during any conjugate eye movement where both eyes are moving together equal and simultaneous nerve signals are sent to the yoke muscles.
Yoke muscles being the muscles in each eye that work together to produce that specific movement.
That's right. So, for example, when you look to the right, your right lateral rectus and your left medial rectus, they both receive the same amount of nerve stimulation.
So both eyes move together smoothly and accurately.
You got it.
But these laws are more than just interesting trivia, right? They actually have clinical implications.
Huge implications.
So why should our resident listeners care about these laws? How do they translate into their clinical practice?
Understanding these laws is absolutely critical for diagnosing and managing eye movement disorders, especially those caused by muscle weaknesses like in paretic strabismus.
Can you give us an example?
Sure. Think about a sixth nerve palsy where the lateral rectus muscle is weakened.
Okay.
Because of Herring's law, when the patient tries to use that affected eye to fixate on an object, the deviation is actually going to be larger than when they use the unaffected eye.
Oh, right. And that's what we call the secondary deviation.
Exactly. It's a key diagnostic clue. Helps distinguish between a new palsy and one that's been there for a while.
And then we have to consider those muscle sequelae.
Oh yeah, the adaptations that happen over time as the brain tries to compensate.
Makes things even more complex.
Absolutely. The brain's always working to optimize vision. So initially you see underaction of the weakened muscle followed by overaction of the yoke muscle in the other eye.
I don't know.
Then the antagonist muscle on the same side as the weakness starts to overact.
Wow.
And finally, the antagonist of the yoke muscle gets inhibited. It's quite the cascade of events.
It's amazing, though, how adaptable our brains are, constantly trying to find that balance, even when faced with these challenges. And we haven't even touched on the sensory side of things yet. how our brains process all this information to create a single three-dimensional view of the world.
Ah, yes. The sensory magic of binocular vision.
That's where things get really interesting. Welcome back, everyone. It's time to wrap up this deep dive, and we're ending on a high note. The sensory side of eye movements. You know how our brains actually take those signals from our eyes and create that incredible three-dimensional world we experience?
It's one of the most fascinating aspects of vision, in my opinion.
Oh, for sure. And at the heart of it all is binocular single vision, BSV.
The foundation for depth perception, spatial awareness, you name it.
And the textbook outlines 5 essential conditions for normal BSV, almost like a checklist.
Yeah, let's go through them. First up, clear visual pathways and overlapping visual fields. Both eyes need to be receiving those crisp signals from the world around us.
Makes sense. It's not just about the eyes themselves, but the whole pathway those signals travel to the brain.
Exactly. Next, we need those specialized binocularly driven neurons in the visual cortex.
This is where the magic happens, right?
It is. That's where the two images get merged.
It's like a team of editors in the brain, meticulously blending those two perspectives together. Incredible.
Truly. Okay, so we have the pathways, the processing centers. What else is critical for BSV?
Well, the textbook mentions normal retinal correspondence.
Ah, yes. That's key. It means that points on each retina correspond to the same point in space.
Like a perfectly aligned map, making sure everything's projected to the right spot.
Exactly. And then, of course, we can't forget about accurate eye alignment. Those extraocular muscles and their coordination play a huge role here.
Making sure both eyes are pointing in the right direction. Even a slight misalignment can mess things up.
Absolutely. And finally, we need roughly equal image clarity and size from both eyes. If one eye is seeing a blurry or distorted image, it throws off the whole system.
Like trying to merge 2 photographs, one sharp, one blurry, just wouldn't work.
Exactly.
The textbook then goes on to these really complex concepts: visual direction projection, corresponding retinal points, the horopter panem's fusional space.
Yeah.
I remember those being a bit tricky to wrap my head around at first.
Yeah, they delve into the nitty-gritty of how our visual system handles spatial information. Imagine looking at a tree. Visual direction is what tells you where that tree is in space based on which retinal cells are stimulated.
So it's like our brains have a built-in GPS for our eyes.
You got it. If the image of the tree falls on your fovea, you know it's right in front of you. But if it hits a different part of the retina, your brain adjusts its interpretation.
So cool. And then projection maps out the tree's position in the external world. It's like creating a mental model of our surroundings.
Precisely. And then we have corresponding retinal points. These are points on each retina that, when stimulated simultaneously, create the perception of a single object.
So if the same point on that tree stimulates corresponding points on both retinas, we see one tree, not 2.
Exactly. Now, the horopter and panem's fusional space are a little more abstract, but they're all about depth perception. Imagine a curved line in space, passing right through the point you're fixating on. That's the horopter. Objects on the horopter stimulate those corresponding retinal points, so they're seen as perfectly single.
It's like the sweet spot for binocular vision.
It is. And panem's fusional space is like a buffer zone around that horopter. Objects within this zone still stimulate slightly different points on the 2 retinas, but our brains can fuse those images together.
And that gives us a single perception with depth.
Exactly. Anything outside of this zone and you start seeing double.
It's amazing how our brains can tolerate some disparity and still create a clear image with that sense of depth. But what happens when things aren't working so perfectly? Like with strabismus, where the eyes are misaligned. How does our brain handle that mismatch?
That's where those sensory adaptations come in. Suppression is one way the brain copes. It basically ignores the image from the deviating eye to avoid confusion or double vision.
But if that happens all the time, especially in kids, it can lead to amblyopia.
Right, where the vision in that suppressed eye doesn't develop properly. Early detection and treatment of strabismus is so important.
Absolutely. And then there's abnormal retina correspondence, ARC.
Yeah, in ARC, the brain actually rewires itself, creating a new sense of straight, even though the eyes are misaligned.
So even with these challenges, our brains are incredibly adaptable.
They really are. Always trying to make sense of the visual input.
And it doesn't stop there. We also see those motor adaptations like compensatory head postures.
Right. Patients might tilt or turn their head to minimize double vision and maximize their binocularity. It's remarkable how the brain finds these workarounds.
This deep dive has been quite the journey. We've covered so much ground, from basic muscle anatomy to the intricacies of sensory perception. It's clear that even the simplest eye movement is this beautifully orchestrated symphony of actions.
And as you continue on your journey as ophthalmologists, remember these fundamental concepts. They'll serve you well.
Always keep that curiosity alive. Never stop exploring the wonders of vision.
Well said.
Until next time, everyone keep diving deep.